Ministers and the Ministers of State from the central government, the ministers from the state of Karnataka, the senior officials from Department of Pharma, Department of Health, and several other ministries, the distinguished audience, thank you very much for assembling today. On behalf of FICCI's Medical Device Forum, which I represent, I am grateful to Department of Pharmaceuticals to champion the cause of medical devices and get us together for the second consecutive year. And I remain hopeful that this is just the start and we will do this for decades to come. I also wanted to personally thank the Secretary, Department of Pharmaceutical, for his intense personal attention and support to the program that we are organizing this time. A little has been talked about the medical devices. I don't want to repeat many things, but it is important to remember that we are growing at a very healthy 15% annual rate, very encouraging. But at the same time, we need to be mindful that today of the global supply chain of medical devices, India is just 1.3%. It is growing fast, but it is relatively small with a limited footprint of the global market. Medical devices in India is a $8 billion industry roughly. And if you look at healthcare in India, which is $110 billion, you will realize that medical technology is a very small part of the large healthcare initiative today. But I must say, and many of you from medical devices will realize this, or from the healthcare practice will realize this, that without medical technology, there is very little health outcome possible. So it has a very distinct, discontinuous impact on medical care. And therefore, as we scale up universal healthcare in India and we scale up the penetration of healthcare in India, scaling up medical devices is but a necessity.